Good morning. My name is Monique, and I'm going to be your nurse today. Can you state your first name and your age for me?
Amaya, 17.
Okay, Amaya, you're here today, and you're going to be here for an assessment of your head, neck, your face, eye, ears, nose, and your mouth. I'm going to clean my hands, and then we're going to get the assessment started. While I'm cleaning my hands, I'm going to be assessing your face for facial symmetry, which means the evenness of your face. I'm looking at your eyebrows. Your eyebrows are even and midline with your nose, and your mouth and your ears. I also notice with your nose, there's no septal deviation. Your nose is also midline. Okay, we're going to go ahead and get started. I'm going to start by inspecting and palpating your scalp, which means to feel your scalp. I'm going to be checking for cleanliness of the scalp. I'm going to be checking for signs and symptoms of infection in the scalp and hairline. I'm also going to be checking and inspecting for lumps, bumps, and bruises. There's no lumps, bumps, bruises, or nodules noted. The scalp is clean and dry. The skin is intact. There's no signs, symptoms of infection noted. The hair is auburn in color, and the hair is also clean. While I'm standing here, Miss Amaya, I'm going to move down, and I'm going to be checking your temporal arteries, okay? I'm just going to feel right here. And the temporal arteries are noted to be strong, even, on both sides. The pulse indicates no thrills. And while I'm here, I'm going to move down and check your jaw. I'm going to be checking cranial nerve number 5, which is the trigeminal muscles. I'm going to get you to open, close your mouth, and clench your teeth for me. Very good. And while I'm here, I'm going to check cranial nerve number 7, which is your facial expressions. I'm going to get you to smile, frown, and puff out your cheeks. Okay, go ahead. Very good. And then puff out your cheeks for me. Very good. And then we're also going to be looking at your face. I'm going to get you to tilt your head up slightly for me. I'm going to be checking your frontal sinuses. And then I'm going to move down and check your maxillary sinuses. Any tenderness here? Any tenderness when I palpate here? Feel here? Okay, keep your eyes closed for me. Your eyebrows are noted to be the skin around the eyebrows show no infection. The hair to the eyebrows have no debris noted. To the eyes, to the eyelash line, there's no signs, symptoms of infection. There's no debris noted to the eyelashes. I'm going to get you to look up for me. I'm checking your conjunctiva, which is pink. Your sclera is nice and white. Your irises are noted to be nice and brown. I'm going to also check your cornea to make sure that it's not concaved. And make sure your cornea is nice and round. Look to the right for me. Okay, look left for me. Very good. And I'm going to be checking, you're checking your cranial nerves, number 3, 4, and 6. So I'm going to hold this object, and only with your eyes, I'm going to get you to follow this object for me. Very good. Other side. Very good. Look at the wall. Look back at my object. Okay. And then I'm going to check cranial nerve number 2, which is the optic nerve. Tell me, what do you see on my card?
Phone.
The card states phone. Okay, also, we're going to be checking your nasal passages. Can you hold one side of your nose for me? Breathe in. Hold the other side of your nose for me. Breathe in. The nasal passages are noted to be patent. Can you look up for me? I'm trying to check the nasal mucosa. There's no debris noted to the nasal cavity, to the nasal hair. There's no debris noted. Close your eyes for me. I'm going to check cranial nerve number 8. And cranial nerve number 1. I'm going to get you to tell me what you smell here. Hand sanitizer. Very good. Okay, Miss Amaya, you can open your eyes for me, sweetheart. Now I'm just going to be checking your ears. Any tenderness noted here with the ears? Okay. I'm going to take a look into your ears. Okay. I'm sorry. There we go. There's no serum accumulation noted to the ears. The ears are free of debris. Okay. And I'm going to be checking cranial nerve number 8. So I'm going to whisper something into your ear. I'm going to get you to hold one ear down for me. And I want you to repeat what you hear me say.
Baseball.
Okay, the other side. Same thing.
Football.
Okay, very good, Miss Amaya. Now that we have that portion done, I'm going to be checking cranial nerve number 9, 10, and 12. I'm going to get you to swallow for me. Okay. Can you open your mouth and say "ah" for me? open. Hold your head up a little bit for me as I'm inspecting the oral cavity, the buccal mucosa, checking the soft palate, the hard palate. The teeth are free of debris. There's no lesions or irritation noted to the gum line. I'm also checking the lips. Okay, that's good. There's no cracks noted to the lips. There's no signs or symptoms of fever blisters or anything noted to the lips. Miss Amaya, I'm going to be checking your neck at this time. Any tenderness here? Okay, no tenderness felt here as I palpate. Now while I'm sitting here, I'm going to be checking the trachea. The trachea is minus and midline. No tenderness noted there. Okay, Miss Amaya, I'm also going to be checking your left nose. So I'm going to get you to hold still for me as I palpate the pre-auricle, the post-auricle. I'm going to be checking the occipital. I'm going to be checking the premandible, the submental, the preclavicle, the posterior clavicle, the superficial. And I'm going to be, can you hunch your shoulders for me? I'm going to be palpating the subclavicular, okay? You can relax your shoulders for me. And I'm going to walk around, I'm going to be checking your thyroid, okay? Any tenderness here? Okay, tilt your head to the left for me. Swallow. Tilt your head to the right for me. Okay, can you swallow? Any tenderness? And no tenderness noted to your note here. Thank you, Ms. Amaya. This concludes my assessment. I'll be following up with report.